Greetings everyone. This is my another video slides created on liver failure and liver cirrhosis. After going through this video, please attend the questions at the end and write your answers in the comments. I will appreciate your response. Thank you. Okay, so let's talk about the GI system. So if you see, there is a esophagus. So when we eat food, it goes to the stomach, and from stomach it gets grinded here, and then it moves to duodenum. It goes to the small intestine, and from there it goes to the large intestine or colon. These are the waste products which come out through the anus. So duodenum is a part of the small intestine. From there it continues to the rest of the intestine, where in a small intestine, most of the digestion and absorption takes place. In the small intestine, the digested nutrients move through the intestinal wall into the blood vessel. These nutrients will later be used by the body cells for energy, growth, and repair from the body. The liver plays an important role in a digestion by producing bile, which travels to the duodenum and helps break down fats so they can be digested and absorbed. The blood carrying the nutrients from the small intestine first goes to the liver. The liver filters toxins, drugs, and harmful substances from the blood. After the blood is cleaned, it travels to the heart, which pumps it to the rest of the body. In this slide, we are going to talk about the functions of the liver. One of the functions of liver is bile production. The liver produces bile, which helps digest and absorbs the fat in GI tract. Then the bilirubin metabolism, the liver converts unconjugated bilirubin. You should all know what the bilirubin is. Bilirubin is a waste product in our body. It's created from the breakdown of red blood cells. So the liver converts this unconjugated bilirubin into conjugated bilirubin, which means the bilirubin now can be excreted from the body through the bile and stool. The other function of the liver is detoxification. The liver detoxifies drugs, alcohol, and toxins from the bloodstream. It helps for blood glucose regulation. The liver regulates blood sugar levels by storing and releasing glucose during carbohydrate metabolism. The liver converts ammonia, a toxic waste product from protein metabolism, into urea, which is safely excreted by the kidney. The liver also helps for protein synthesis, which include albumin. Albumin is necessary to maintain plasma oncotic pressure and prevents fluid from leaking into tissues. The other plasma protein important for metabolism and transport. Clotting factor production. Liver produces clotting factors like a prothrombin, which helps prevent excessive bleeding. The liver stores and uses vitamin K to produce clotting factor. If the liver fails, there will be a decreased clotting factor production, which results in an easy bruising, bleeding gums, and prolonged bleeding time. Liver also helps activate vitamin D, which can, if there is a liver failure, which can lead to poor calcium absorption, weak bones, and bone pain. If liver also stores large amount of vitamin B12, if there is a liver failure, the vitamin B12 deficiency can lead to fatigue, anemia, and nerve problems. Same way liver stores vitamin A during the liver failure, it can lead to a vision problem, especially the poor night vision. Let's talk about liver disease. If inflammation or hepatitis does not dissolve due to various reasons, it leads to fibrosis and further leads to cirrhosis and liver failure. Cirrhosis is irreversible. Healthy tissues replaced by scarred tissues. Medication at this time can slow down the progression. How's everything going? Everything. Lennox cirrhosis is a liver cirrhosis caused by long-term alcohol use. When a person starts to drink heavily, the excess calories are stored in the liver and the client develops a fatty liver. At this stage, it's reversible. A person stops drinking, the fatty liver converts back to a normal liver. If the client continues to drink heavily for many years, the alcohol damages the liver cells and then these damaged liver cells converts into a scar tissues and liver becomes hard, nodular and cannot function properly. This is head-to-toe visualization of signs and symptoms developed due to liver failure. We'll start with brain and neuro. So the liver cirrhosis causes confusion, memory problem, asterixis, which is a flapping tremors of hand, hepatic encephalopathy. If you go to the skin and eye, you will see jaundice, yellow skin and eye, spider angioma, Palmar erythema, pruritus. If we go to the chest and hormonal effects, we'll see gynecomastia in men, loss of body hair, hormonal balances. On the abdomen, you will see ascites, which is a collection of fluid in abdomen, and large spleen, caput medusa, GI bleeding, these are the bleeding symptoms which can cause hematemesis or melena, esophageal varices. And if you look at the extremities, you will see there is a peripheral edema, muscle wasting, and weakness. Let's summarize all the symptoms into three for easy memory. The first one, portal hypertension, second, liver failure, and third, toxin buildup. So portal hypertension is ascites because it's caused by liver blocking the blood flow. So which leads to ascites, splenomegaly, esophageal varices, and caput medusa. Liver failure leads to jaundice, low albumin and edema, and bleeding. Toxin buildups causes confusion, asterixis, and encephalopathy. Important lab changes due to liver failure. Liver enzymes which are AST, ALT increases due to liver damage. Bilirubin, which is a waste product, increases in blood and leads to jaundice. Albumin levels decreases, which leads to edema and ascites. PTINR increases, leads to bleeding. Platelet level decreases, leads to bleeding. And ammonia levels go high, which causes confusion. These are the common medications the patients get who have a liver failure. The lactulose is very important to remove ammonia, which is a waste product. Our goal is to get at least 2 to 3 soft stools per day if patient is on lactulose. Spironolactone is a diuretic if patient has ascites. Sometimes they also add a furosemide to remove extra fluids from the abdomen. Vitamin K is given to prevent bleeding and it helps in a clotting. Mental status is a priority as confusion can lead to safety issue. Daily weights monitoring measures the accumulation of fluid in the body. Here I would like to let you know that increase in 1 kg of weight is equal to 1 liter of fluid accumulation in the body. Measure abdominal GERD to assess the ascites, monitor ammonia level. The diet is low sodium to prevent edema and ascites. We do not restrict protein in this patient unless they have encephalopathy. A patient present to the emergency with a vomiting blood in cirrhosis. So in this condition, we suspect esophageal varices rupture. The priorities at this time is a airway maintain. They are breathing okay. They do have a IV access, and then we prepare for endoscopy so that we can diagnose and fix the problem. If ammonia level decreases, mental status will increase or improve. Less ammonia is equal to less brain fog. Let's remember some tricks. Remember, lactulose sweeps the ammonia out and there will be a less brain fog. If your question asks, after giving lactulose, which finding indicates effectiveness? Look for improved alertness, orientation, or decreased confusion, not just ammonia lab values. Identify mental status change. If confusion, lethargy, or asterixis, it means there is a high ammonia. Link lactulose action to ammonia. Lactulose trap ammonia in the gut, which get excreted in the stool and ammonia level drops. Remember, ammonia decreases, mental status improves. Again, watch for stool clues. Lactulose causes soft, loose stool, not the watery stool. If the stool is too watery, there is a risk for dehydration. If there is a too little stool, ammonia is still high. So increase the dose. Thank you everyone for listening to me. Please go ahead and answer these questions in the comments below. Thank you and see you in another video.